all to the second part of Taking Control of Workers' Comp webinar series. We have prepared a very important topic for all, and we're diving deeper into fixing communication gaps and to improve claims outcomes. Most of you know me. If you don't, my name is Svetlana Simogutina. I'm the marketing director for FastCare Urgent Care. And today we have on a call Zachary Rosenthal with EIG Risk and also FastCare Urgent Care Medical Director, Dr. Matthew Korn. I'll let both of them introduce themselves, and Zach will be our presenter today.
So, Doctor, if you want to go first.
Sure. Thank you. Good afternoon, everyone, and thank you for joining us. I'm Dr. Matthew Korn, Medical Director of FastCare Urgent Care and Occupational Medicine. I've been doing workers' compensation for over 20 years, working very closely with injured employees, employers, case managers, and adjusters. We opened FastCare in 2004. Previously, I had done some extensive work in occupational medicine, and I wasn't so happy how the industry was going in South Florida. So we decided to open up a center that would treat an injured employee with good care in like a warm, friendly environment. It all starts from the front desk to the medical assistant to the provider to the back office. Shortly after, we opened up our other center, FastCare Miami Beach, and we've been working with most of our clients since the beginning. A lot of them are on this call, so welcome. Also, throughout my career, I've had the opportunity to manage a wide range of workplace injuries and focus on treatment approaches that benefit both the patients and the employer. I'm looking forward to today's discussion and sharing some insights in the field from my experience that I've gone through. So welcome all, and thank you for joining us.
All right. Awesome, Doctor. And my name's Zachary Rosenthal. I'm with EIG Risk. My background is in occupational medicine. I work for a group of medical centers in South Florida that also treated workplace injuries. So in my experience, I was the liaison between the medical center, the carrier, and the employer, making sure we have successful claim outcomes. And in that, I learned a lot about claims management. So today, I want to share with you everything I've learned, plus what I've learned in my last year in my new role as a senior risk advisor. So I've now transitioned to the insurance side of the business, helping more on safety and risk consultation. And hearing it and seeing it from a new perspective has really opened up my eyes onto what it means to run a successful program. So today we're going to share some insights from the professionals here on what we've seen over our years of experience when it comes to treating workplace injuries. Some of the concepts we're going to talk about is workers' comp focused, but a lot of it is also general risk and safety. So these concepts can also be applied to other forms of risk, such as auto liability, general liability, employment practices. So again, the focus is on workers' comp, but have an open mind and see how can we implement some of this into other roles within the organization. So this is just a quick recap of our first session in case you weren't on there, but it's also a good refresher. So at my company, EIG Risk, we've built a foundation called People Risk Management. And what we believe is that your employees are your greatest asset, but also your greatest exposure and liability. And without the right processes and plans in place, that's where we leave gaps in our program. So we call it P4, People Risk Management, where we focus on 4 key areas to be proactive in claims management. So it begins with pre-hire. What are you doing and what are your filters to avoid hiring a workers' comp claim? With a show of hands, who has ever hired a workers' comp claim? So, oh, I see some hands going up. And it's just the environment we're in. We're in Miami, and there are people out there that are looking to take advantage of the system, hire an attorney, and go from company to company having a workers' comp claim. Now, that's not the majority. Most employees are there to work and want to get better and heal and come back to work. But again, we have to have processes and protocols in place to avoid exposures. We then look at post-offer. What are we doing once we make a conditional offer to integrate that employee into our safety culture? So what type of onboarding are we providing that employee? Then we talk about prevention, so ongoing safety initiatives to help reinforce safety and claims management. This holds accountability for both the employees and the supervisors. And we'll get into that a little more later. And then post-claim, do you have a strategic plan to manage claims and to address them right when they occur? And as we're going to talk about, leadership is the foundation of all of this, and that it all starts with your managers and supervisors. And we have to think for a second, how prepared is your manager to respond to a workers' comp claim, and how do they handle safety within the organization? So again, topics we're going to get a little deeper into later on in the conversation. So let's talk about communication because that's what the main focus of this training is today. And I want to start with this quote. Communication after an accident builds trust. Silence breeds rumors and fear. So think about it. When you have a workplace injury, does your employee understand the workers' comp process? Do they understand their rights? Do they know about return to work? We're going to address this as we continue to go through this lecture. So let's begin by talking about some communication breakdowns. So where do we see some pitfalls when it comes to a workers' comp claim and how we communicate with all parties involved? So let's begin. Let's talk about the employer to employee relationship because that happens before a claim happens and then also after a claim. So before the claim, as we were just talking about, you want to make sure your employees understand the workers' comp system. From day one, they should know their rights and that you, as the employer, are there to treat anything that medically occurs or any work-related injuries that occurs on the job site, and that you're there to provide that medical treatment for them. And that the goal is return to work, and that we want them back on the job, being able to make their original pay and be able to integrate and return after a workplace accident. So that's the first thing is that how are you communicating with an employee before they have an accident? And is this something that's part of your orientation and training on day one? And then the same thing as after an accident is that employee understanding that return to work is key. We're going to talk more about that later in the training, but start thinking about does the employee know that you have light duty jobs available for them and that also there's no retaliation for a workers' comp, that the employee shouldn't be fearful to report an injury to you. You want to be able to take care of them and treat that injury right away. There shouldn't be delays in cares. So these are conversations we need to have with our employees from day one. So then let's talk about employer to provider, because this is also something we want to be proactive with. And where the medical center gets involved is that before an injury occurs and before you send them to the clinic, have you established protocols with your workers' comp medical center? They should know who is the authorized contacts, who's your workers' comp insurance, do you perform drug testing, do you have light duty available? If you send them over to the clinic and you haven't established these protocols, you're delaying care and you're at a disadvantage. So, Dr. Korn or Lana, how do you feel this benefits you when you have an established relationship with one of your clients?
Zach, I'll take this question. Oh, this communication protocol that we set up is truly everything. When we onboard a new account, or even when it's an existing account, I'd like to follow up a few times throughout the year to make sure that all the information we have on file for that employer is correct, the email and the contact phone numbers, to make sure that our coordinators, workers' comp coordinators and specialists know whom to communicate with on the employer side and who should be receiving the documentation. We have a dedicated team at both clinics at Aventura and Miami Beach location who on a daily basis reach out to the employers with DWC 25 and also let them know if there is no shows to those follow-up appointments. So this is key from our end, and we have a very robust and good structure set up to support the employer and make sure also that employee continuity of medical care does not stop.
Dr. Korn, how do you feel about an employer calling you before they're sending a patient because there's some unusual circumstances with an injury or there's some more information they want to give you or talk about return to work? Do you feel those are beneficial, those calls?
Yeah, Zach, thank you. Absolutely. Those calls can be very beneficial. First, let me kind of start from the beginning. The more information you can give to the provider, it helps tremendously. When an injury comes in, if you can list the body parts, or even the history of what happened. It helps us a lot, on the case. And what Zach was saying, if there's any other circumstances or anything else, it's really important for us to know. I can give you an example of a case I saw where it was important. We had a injured employee came in. It was a motor vehicle accident on the job. They were complaining of multiple body parts and a very high degree level of pain. The employer called us a few days later and shared some information that they did an internal investigation, and they were able to come up with that the impact was 1 miles per hour, and there was no damage on either vehicles. So this type of information was very useful to me because now I think, well, is there a pre-existing condition? Is there something else going on? And it really helps us dig into the case a little further. So like I said, communication is key. We're always accessible. If there's anything you want to talk before a case, after a case, call the provider. If they're busy at the time, you leave a message that please call us back before you see the patient or after. But this information is very beneficial for us. So absolutely.
Yeah, very good insight. So now let's talk about the employee to provider. So that employee comes in with the perception that you're the company doctor. They told me, oh, we got to go to FastCare for treatment. So that patient may be a little nervous. We want to make sure that they feel comfortable with the care, and that everything aligns with what the employer authorized. But I'm sure this is something you're used to addressing, and that by the end of the visit, I could imagine they feel very comfortable with the care, and that a lot of times they probably ask for you to become their primary care physician.
So, yeah, that does happen. Again, the employee comes in, they're injured, they don't know the process. If it's the first time they've had an injury, they don't want to lose their job. They don't really understand if they're still able to work with restrictions. So I think just, talking with them and explaining to them how it works and just explaining their care and the plan, I think it helps, a lot.
Yeah, for sure. And then when we have the adjuster involved, they're communicating with both the employee, the employer, and the provider. So there's different ways that they're communicating. Lana, is there a poll we can put up here? Just talk a little bit about claims management and where does it really fall? Because I want the feedback from the audience to see who do we think really manages the cost of a claim. So we got some choices up here. Is it about 50-50 your carrier versus you, the employer, 70% the carrier, 30% the employer, or is it more the employer that's managing the claim? So we'll give everyone a minute to fill this in. Oh, it's
Let's give it
okay. All right. I say we got a mixture here. So looking at the results, I would say we kind of have it split. Most feel that the employer is in control. Now, this was a question we asked on the last session, so we were checking to see if you were paying attention the first training. But I would agree that around 70 to 80% of the claims management falls on the company. It's because that you're the one really handling the employees, returning them to work, making sure documentation starts from the beginning, directing them to the care. The adjuster plays an important role, but if you don't give that adjuster a good claims file, the adjuster is not going to have much to work with. So we have to have a program in place to be able to be proactive and manage these claims. So with that, the adjuster has a very large caseload. So we have to make sure that we're giving them good information. So what is the employer providing that adjuster right away? So you want to make sure you're doing your first report of injury. If you do an accident investigation form, that's also good information to give them. If you have video footage, anything related to the claim, that employer should be communicating with the adjuster, and also the employer should be communicating with the provider on those same information. It's those first 1 to 3 days that are pivotal, that we're making sure we're getting that employee back on the job. So we want to communicate that all right to the insurance carrier so that they can start processing the claim. Now, as far as like the adjuster and the provider, Dr. Korn and Lana, what do you have in place to make sure you're having enhanced communication with them?
on our end, on FastCare side, we truly put a robust system in. We have dedicated workers' comp specialists at both clinics who check on a daily basis by patient to make sure that adjuster is already available, that the claim number is already in the system and adjuster assigned. It takes about 24 hours for that adjuster to be assigned from the moment you call the claim in. So we do encourage all of our employers to call those claims in as soon as possible. And by the second or third visit, we can already start communicating with the adjuster. And we'll be sending to them referrals, DWC 25, notes, all the pertinent information that we have in the system to make sure that they can start scheduling any additional services for that injured employee.
And it is very important to call that claim in because from a provider standpoint, if we have to refer them for diagnostic testing, physical therapy, anything else, it's important to get that information to the adjuster. And if you ever worked with any case managers or adjusters, they are really busy. They have a tremendous caseload. So having a dedicated team, like FastCare, we have people that will make sure the notes were sent over, make sure the referrals were sent over, make sure they received it. If they need any assistance in setting anything up, they will help them as well. So it helps all around.
Yep, that communication is key. We want it right away. And then lastly, I put there in the corner the broker. So as an insurance broker, what is the role in communication? I would say they should be right there in the middle. They should be that middleman between the employer, between the employee, between the adjuster, making sure that care goes smooth. And they should also be proactive about it. That broker should be helping you succeed and setting up plans and processes before an accident. So make sure you're getting the most out of your broker relationship in addition to the provider and the carrier. So let's talk about why communication matters. So here's some stats and some information that we've determined really makes the impact and why we're doing this. So there's a reduce in employee trust and engagement if they don't feel that the company cares about them or is communicating about workers' comp claims, and they just feel that they're not sure what their rights are. They just went to the medical center. They don't have any clarification on the DWC 25. They don't know if they should return to work. This is really how you get a disengaged employee. It also increases the anxiety and depression of the employee. So if they just, again, not sure if they still have their job, is this going to be a negative consequence on me? This really does help and really affect the employee in their mental state. And this stat is really troubling. 96.4% of injured workers were unaware of the core principles of their claim. So that means most of these workers just don't really understand how the workers' comp system works. So again, that's why it's so important that we're explaining this to them proactively to understand what it means to have a workplace injury. And
Zach,
I'd say oh yes.
who is really responsible for communicating? Does this all fall on human resources department?
Oh, that's a great question. I would say yes, there is a responsibility of human resources and management to explain this to employees, but I would argue to say this is also something that you should be empowering your line supervisors and managers to be doing. They should also understand workers' comp practices and they should be reinforcing it with their employees. When you think about it, during the day, those employees are interacting with their line managers much more than they're coming to the human resources department. So if they're not feeling comfortable with workers' comp, the person they may go to is their line manager. And if that manager doesn't understand and can't explain it to them, we're at a disadvantage. So I would say doing training with your managers is going to be key. And we'll talk a little bit more about that later in the presentation, but that was a great question, Lana. And I would say this is probably the one of the greatest reasons why communication matters is there is a higher chance of litigation if the employee doesn't feel that they're having proper communication. I would say it's around a 2 to 300% more possibility of that employee retaining an attorney. And once they have that attorney, I would say the costs go up about 350%. So it's significant once an attorney's involved. And we're going to see longer claim durations and delays in referrals. I know I did a survey once where we said the claimant attorney, is their role to make sure the employee gets back to work, or is it their role to keep them out of work? And I think the majority said keep them out of work. And we had a small percentage that said get them back to work. But I think those were just the claimant attorneys on the call that selected that. But Dr. Korn, I mean, do you see delays in referrals when you have an attorney involved in the case?
Yeah, so I would say from the provider standpoint, it is the delay in care. Once you have an attorney, the case manager, the insurance company goes to the attorney. It's one more layer to schedule referrals, appointments, even specialists. So I would say from the provider standpoint, it's a little bit of a delay in care. On the backside, from an employer standpoint, it's all, and an insurance standpoint, it's also the financial cost. But yeah, we definitely get a delay, unfortunately.
Yeah. And then we talked about a greater chance of a lost time claim. So just to explain what that means is there's medical only claims and then there's lost time claims. Medical only means that there was no indemnity paid, where the carrier didn't have to pay wages because the employee was out of work for a certain period of time. So that's why we do return to work and we want to keep claims medical only because there is a cost advantage to it. So to make it a lost time claim means the employee was out of work for 8 or more days. So once we have a lost time, the impact is on your experience modification. So this is a rate that's calculated with your workers' comp insurance, and having more lost time claims and more frequency of claims increases that experience modification, which in turn raises your annual premium. So you end up paying more for your workers' comp insurance by keeping employees out of work. So that's why we always reinforce return to work and keeping claims medical only, because there is that cost advantage. And I'd say that workers' comp's the most controllable line of insurance, that with the right plans and processes in place, you can really keep those costs down. So, what is the role of the medical provider when it comes to communication? We've touched on some of these, but let's reinforce it. So, verbal communication before and after treatment, we talked about having that doctor available to communicate before an injury happens. The employer should be able to pick up the phone, call the doctor, go over treatment, and then the doctor can also be there to call the employer after treatment if they want to give an update on restrictions. Let's say you also need clarification on the job demands. So either the employer gets the DWC 25 and they need to clarify the restrictions to make sure it's relevant to the job functions, or they're unsure if the employee can do something. Then you can call the doctor and just question them and say, "Hey, doc, if this was tweaked by 2 pounds, we can have them do this job. Do you think it's safe for them to do this?" So at the end of the day, I would say the message is don't feel uncomfortable calling the doctor. You should have that relationship with your provider and be able to pick up the phone and have a dialogue about the treatment of an employee. You want functional restrictions, as we talked about. The language should be specific on the DWC 25 as far as what they can and cannot do. We just don't want to have vague restrictions. So if you're seeing a DWC 25 completed by a doctor and it just doesn't seem like it's well thought out, I would say maybe question going to that provider. And then those clear work status notes, we want specific what occurred during that treatment visit. And then the doctor should be addressing restrictions on every visit. So if you're seeing that you have the same restrictions week after week, call the doctor and find out why is this patient not progressing, and then try to get to the bottom of it. So have a voice. The medical provider is there. They're going to do what's medically needed, but feel free to have that open line of communication. And I'm sure Dr. Korn agrees that he appreciates when an employer reaches out and wants to discuss a case with him.
Sure. Yes. If anyone has any questions, we're always happy to talk about it. As Zach state, when injured employees leave, they get a copy of the DWC with the work restrictions on it. We go through it with them. But it's real important. If there's any questions, absolutely reach out. Even some employees that are injured, they can still, be doing physical therapy. They can still have injuries, but still be doing, regular duty because their job may be they sit at a desk and their injury is an ankle. So they do have an injury, but they can still do their regular duties. And on the other side, like Zach said, if there's lifting restrictions and their job, the amount we put 10 pounds and uh, what they occasionally lift is 11 pounds, give us a call. We'll assess it and say, you know what? Yes, he's able to do that. So we're always available, and communication is always great.
So if there's one thing you should take away from this presentation is this slide here. It's showing care and concern for an injured worker. This is something I've always been preaching in my career is that we need to make sure that employee feels cared for and wanted for. So after an accident, how comfortable do you feel picking up the phone and calling that employee and seeing how they're doing? How was treatment? Is everything okay? We're going to see you tomorrow at work. Hope you feel better. And we do have light duty available for you. So reaching out, speaking to that employee right after an accident is key. I know I have clients that will send a get well card. They'll have it signed by either their manager or HR and put it in the mail and they get that card. And a little touch like that goes a long way. The employee feels that you care about them. There's going to be a much lesser chance that they're going to feel they need to get an attorney because you're there for them. You want to make sure they get what they need medically. Um, Lana, tell us a little bit more about DWC 25 and what would you recommend for the showing care and concern?
I wanted to highlight the process. So we have an initial visit for the initial when the injury occurs, and during the discharge, the employee would get their DWC 25 for the first time, and they might be confused. This is all happening for the first time, so this would definitely be a great time to call an employee after the visit. They will be discharged with the notes. They explain their restrictions, as well as DWC 25 is always printed for every single person that's leaving FastCare. Their second appointment is 2 to 3 days after as a follow-up, and that would be another opportunity to give them a call and find out if everything is clear to them. Have the adjuster been assigned? Had the adjuster contacted them? The third visit is typically a week after, for them to come back to the clinic. So these are kind of a couple of different opportunities that you may touch base with the employee to make sure that they do feel that somebody in the company is looking out for their health and wanting to see if their recovery is on track, if they had contact with the adjuster and everything is clear.
Good point. So let's switch gears. Let's talk a little bit about return to work. So I love this quote. You don't get injured workers well to put them back to work. You put them back to work to get them well. And what studies show is that employees who stay functioning, engaged on a job after an accident are going to heal faster than an employee who just sits home laying in bed all day. Once they start watching TV, what's on every commercial break? It's attorney commercials. So what we want to do is make sure we're returning them to work after they have the accident. So what does a strong return to work program look like? Well, first thing is we need to make sure there's immediate reporting. So right away, that employee feels comfortable reporting an accident to the supervisor, everything getting documented and determining what treatment is needed. Is this something that needs to go to the urgent care center? Is this life-threatening? Do we need to get them to a hospital? Or is the employee stating, you know what, I don't really need to see a doctor right now, which is fine. We can't force the employee to go to the clinic. I would say is we want to have a refusal of treatment form. So there should be a one-page document that the employee signs off on. This was my injury. This is the injured body part. And then at this time, I'm not seeking medical attention. And if you need any of these forms that we talk about or need guidance on this, more than happy to help you after the call with setting up some of these protocols. We also want to have the clear work status communication. So when they do go to the doctor, right away, we're communicating with that employee. These are the restrictions you have. We have light duty available for you. We expect you to come back to work. If that employee now says, oh, no, I don't feel comfortable, I don't want to come back to work, at that point, this could be something where they need to use their PTO time because you do have work available for them. It's not just a holiday because they had an injury. No, they're expected to return to work. So this is something you definitely want to communicate with the adjuster that you have offered them light duty. This is the position we have, but they're refusing to accept the light duty. Also, if you're having trouble finding modified work or modified duty for the employee, it might be beneficial to call the doctor, ask them, hey, doc, do you have any jobs you recommend this employee can do? This is our industry. We're in hospitality. This is the position they normally do, but we're not sure where we can place them. I'm sure the Fast Care team has a lot of experience in this and can provide some suggestions on modified duty that the employee can do. You can get creative with it. I know we've had employees where they can't stand, so they just fold silverware in the kitchen or answer the phones or do security work. So there's always something you could find the employee to do in the industry. There are companies where there is no light duty, but there are options available. There's partners that work with your insurance carrier to place those employees, let's say at a non-for-profit organization, so they can do volunteer work for their light duty. They'll go to a Salvation Army or a Goodwill, but there's always something you can do. We should never just be taking an employee off of work after an accident. And then very important is we keep reinforcing is that employee communication. We need to stay in touch with them. That communication and the return to work go hand in hand. I
Zach,
thought it would be good now. Oh yes, sorry, Lana.
I have a quick example. We had one of our clients, and one of their employees got injured on a construction site. Now, this individual employee could only be in a wheelchair, so they did find him a light duty. So he became their safety person. He became the person who would observe all of the other construction employees and making sure that they have followed all the safety protocols and company guidelines. So even in those cases where you really kind of can't come up with any light duty, it really good to be creative and involve that injured employee. And then I believe he even became went up in ranks and became a safety person for that company after that incident.
That's a great story. So yeah, you could turn the a work-related injury and restrictions into a positive outcome where you now have a new safety manager. So I'd love to hear that. So let's just tackle a little bit this DWC 25 because I feel that not every doctor completes it the same, but I'd love to get Dr. Korn's input on some highlights and some things that an employer should look at when they're reviewing a DWC 25. Doctor, can you share some insight with us?
Sure. I mean, we could really spend an entire lecture just on this form, so I'll keep it more on the brief side. But from an employer standpoint, there are certain categories you should definitely look at. Section 112, the diagnosis. You should know what are the body parts being treated? What is the diagnosis? It is real important to understand that. Also, on follow-up appointments, some people may check off in that same section one, just number 9, no change since last visit. So the body parts stay the same, but definitely review that. Next good one to review is the section 3. Section 3 is anything that was done for that patient. Did the patient have an x-ray? Was the patient placed on medications? What medications are it? They'll be listed there. Was the patient sent out for any referrals? Were they sent out to physical therapy? Were they sent out for diagnostic testing like an MRI or a CAT scan? Were they referred out to a specialist? So all that will be listed under section 3. One of the most important sections from your standpoint also, of course, is section 4. If you check off 23, modified duty, what are the restrictions? The restrictions should be very specific. No lifting, pushing, pulling, carrying 5 pounds, no reaching above with the right arm. Also, something that I get calls back, just so you know, there is a part on 23. If you check on the bottom, it says other or comments. I get some callbacks saying, oh, the patient was put on modified duty, but there's no restrictions here. Definitely look at that category. That could be something sedentary work only if a patient had an ankle fracture. That could be a laceration, keep wound clean, dry, covered, no use of the right, very specific index finger. So definitely make a note of that one too. It's good to look at. And then section 5, I would say anticipated MMI date. A lot of times you can't tell. Sometimes the doctor's giving a rough estimate. It's not an exact time, but say a patient's coming back, they're doing better. They only have 3 physical therapy treatments, and you think they're going to be, anticipated MMI by that week or the following week. A lot of times we'll put it on there. So it just gives you an idea of the plan and what the doctor's thinking. But this form is pretty intense. If anyone does have any specific questions on it, I'm always happy to go through it with them. But like I said, there's a lot. But I would look out for those points, certainly. It would be beneficial.
Awesome. Appreciate it, doctor. So I just want to again get back to the role of supervisors and managers. And here's another quote we got here. Managers don't just manage operations, they manage risk. So if your manager's only looking at the operational side of things, we're missing out. because they need to take ownership of risk and safety. What this means is they have to build trust with their employees in all aspects of the work that the employees do. So, talking about leadership's role, those supervisors drive outcomes. We have to recognize that they're spending a lot of time with those supervisors and managers and not much time with human resources, and that they need to be the leaders of risk, safety, and claims management. As I said, it's all about is building trust and respect with their employees. So, do your supervisors know the role? A lot of time, a supervisor is put in the role because they're a high performer, but have they ever led a team of employees? So, what we need to do is give them the proper training and education on first, what does it mean to be an effective leader? And then what is their role when it comes to risk and safety? It's all about company culture, safety culture, and they need to be on board with it. So another big takeaway is this quote here at the bottom: know the way, go the way, and show the way. So first they have to know the way. They have to understand leadership and the role they play in the organization. And then they have to go the way and show the way. So are they leading by example? Are they following the safety rules themselves? If they have an injury, are they reporting the accident right away? Are they going through the proper channels? So they have to be the trendsetters of the organization. So if you have a manager who's not doing this, how could you expect their employees to do the same? So I would say the first thing is to go through a training like this with your managers and talk about the important role they play. When I start working with an account, this is one of the first things I do is I come in, we have our EIG Leadership Academy, and we do a series of trainings for your supervisors and managers talking about leadership and the role they play within the organization. I don't think it's really a corporate leadership training, but we do get into topics and we have a conversation talking about the why. Why is it we do what we do? They need to understand what the impact their role plays within the organization. And then briefly, I just want to touch on the claims action plan. We did review this in the last training, but I think it's important we just cover it again. That remember, those first 3 days, our goal is to keep the claim medical only. So what we want to do is return that employee to work, reviewing the work status reports right away, getting them back on the job. Within 7 days, we need to get all the paperwork to that insurance carrier or TPA. So as we talked about, the first report of injury, any additional documentation about the claim, video footage. If we need to get them the average weekly wage statement, make sure we're getting that to them right away so that adjuster has time to review the case. Because that adjuster, they have 14 days to review the case for compensability. So we want to give them plenty of time to be able to go through all the details of how the injury occurred. And then the adjuster does have a 120-day investigation window. They can set this up if they feel they need more time to review the care. But again, what we want to do is be timely with this and follow this action plan. And we're just going to go full circle here. So we talked about in the very beginning the P4 process. This is key to having strong communication and return to work. We need to set the expectations from day one. Before we hire an employee, we should have the right hiring filters, the right onboarding filters, prevention strategies, the claims action plan. So that P4, that's really what we covered in our first webinar. We talked about the AIM approach. So on the FastCare website, there is that first webinar. So you can go there and learn more about the specific action plans we recommend for our clients. So definitely take a look at that. And if you want to learn anything more about P4, people risk management, feel free to reach out to me. I'm more than happy to come and speak with you, talk more about our program. We like to start with doing our risk assessment where we will evaluate these P's and look at what you're currently doing because I'm sure some of these things are in place and you have a strong program, but our goal is to take you from good to great. So how can we build on your foundation and maybe tweak some processes, enhance some forms, and really put some additional filters and strengths to your workers' comp and overall claims program? Because as I said, we focus on workers' comp, but these apply to other exposures like the auto, like the general liability. Cyber is a hot topic right now. I'm sure everyone is dealing with those phishing emails. So if you have the right training right from day one and that employee didn't click on the phishing email, I'm sure that would cause you a lot less of a headache. So again, think big picture sometimes when we're talking about these topics. So with that, are there any questions from the audience? You've got some experts here. You've got Dr. Korn. Anything medical, anything you'd like to address with us while you have us here?
The chat is open. You can just type in your question and we'll be able to answer them.
Okay, and don't leave because we have some prizes. Okay, let me go ahead and set this up. Okay, I think I see one question here. Let me here, I got a question here. What should I do if an injury happens outside of business hours or the employee goes right to the hospital?
I can take that one if you want. So FastCare, we are open 365 days a year, extended hours, weekends, evenings. But if a patient does end up in the emergency room, which does happen, it's important to make them a follow-up appointment when they're finished at FastCare. The emergency room physician, it's set up a little bit different. They don't have the same continuity of care. A lot of times when they're seen in the ER, they'll automatically uh, be given a referral for like orthopedic or specialist. That referral may not be needed. Also, I've seen a lot of times on the DWC they take people off of work, and there could be work restrictions. So I would say after they've seen in the ER, encourage that employee and tell them to come into Fast Care for that follow up. That way we can take a look at everything, see if there is a modified duty they could do, see if that special appointment is necessary. Is not, we can review their medications. So I would say definitely send them in, the sooner the better.
Awesome. So with that, just want to provide our contact information. So here's my information. If you have any questions, anything you need on our end, you have my email and cell phone number there. And then also we have Lana's information. So if you need to reach out to her, if you're an existing account, need to do an update, she's available. Or if you're a new account and want to set up protocols, that's where I would start. And I'm sure she can also get you in touch with Dr. Korn. Oh, I think
Thank
we
you
have.
all for coming. We appreciate you taking the time today to listen to this important information. I enjoy working with all of you on a daily basis. And as I mentioned in the beginning, I'll be in touch with you every couple of months to make sure that for information we do have in the system is up to date and we're following all of your guidelines and the protocols.
Yeah. And just one thing about the prizes. So we decided we want to only give the opportunity for the people who were attended to win the prize. So we've made note of everyone who actually participated, and we're going to do on the side because we didn't have the names prepared. We're going to spin the wheel on the side with the people who participated, and we're going to reach out to you directly. So there's going to be a follow-up email that Lana sends to everyone who registered, but we're going to put the first names of the two people who won. So that everyone knows there were winners. There are going to be two winners, but we want to make it fair in that for only the ones who attended get to win the prize. So if you registered and you weren't here, unfortunately, you're not going to be able to win this time. So this is encouragement for the next one we do that you're here for the live session. So look out for the email. We're going to announce the winners there, and good luck to everyone who attended.
Good luck.
Thank you all.
Thank you all.
All
Take
right, thanks
care.
everyone. Have a great afternoon.
We're getting a lot of hearts and thumbs up.
That's nice.